Welcome to the overview of the Canadian and BC healthcare system. This video is a brief look into how healthcare is organized in Canada and BC, and Doctors of BC's role in the healthcare system. Canada has a publicly funded healthcare system. This means that all Canadian residents have access to medically necessary services without having to pay out of pocket to see a doctor or be admitted to a hospital. So who pays? About 25% is covered by federal government contributions to the provinces and territories. The remaining 75% is covered by provincial and territorial government revenues. Roles and responsibilities for healthcare services are shared between provincial and territorial governments and the federal government. The federal government is responsible for product regulation, research and health promotion, and delivering health services to specific populations. The provincial governments organize, manage, and deliver healthcare services for their residents. Each province and territory must ensure that its healthcare system operates according to 5 principles set out in the Canada Health Act. The public administration principle mandates that a province's healthcare system is run by a public authority and does not operate on a for-profit basis. The comprehensiveness, universality, and portability principles mandate coverage to all residents for all medically necessary services, even while outside their province of residence. And the accessibility principle mandates that all residents have reasonable access to medically necessary services, regardless of economic status. So how is healthcare organized in British Columbia? There are 5 regional health authorities in BC that are each responsible for delivering healthcare services within their geographic areas. Fraser Health Authority, Interior Health Authority, Northern Health Authority, Vancouver Coastal Health Authority, and Vancouver Island Health Authority. The Provincial Health Services Authority works with the regional health authorities to deliver provincial programs such as cancer care, transplant, and BC Children's Hospital. In BC, the First Nations Health Authority is responsible for service delivery and funding health programs in partnership with First Nations communities. How is healthcare delivered in BC? Healthcare services are delivered by physicians and other providers such as nurses and pharmacists. All physicians who practice medicine in BC are registrants of the College of Physicians and Surgeons of BC. The college ensures doctors are practicing in a competent, ethical, and legal manner. Healthcare can be broadly divided into primary care and specialist care. Primary care is delivered in the community by general practitioners, often called family doctors. Family doctors may also provide hospital-based services, depending on their training and their location. Specialist care is delivered by specialists who have additional training. In non-emergency situations, patients are generally seen by their family doctor in the community and then referred to a specialist for further investigation and treatment in the community or hospital as necessary. Patients who require urgent or emergent care are seen by the appropriate physician at the hospital. Health authorities are responsible for all healthcare services delivered in hospitals. They also provide certain services in the primary care setting, such as mental health and addiction services. How are healthcare services paid for and funded in BC? Healthcare services are paid through the Medical Services Plan, or MSP. MSP provides BC residents coverage for medically required healthcare services. About 2/3 of residents also have private insurance, which provides extended coverage for services not included in the public system. Approximately 40% of provincial revenues goes towards funding healthcare. 24% of this goes to paying physicians, the majority of whom are paid through MSP on a per-service basis, known as fee-for-service. Physicians who are not paid on a fee-for-service basis are paid through alternative payments, such as a service contract or salary arrangement. What is Doctors of BC's role in the healthcare system? Doctors of BC promotes a climate in which physicians can provide the highest standard of healthcare while achieving maximum professional satisfaction and fair economic reward. We negotiate an agreement with government on physician funding and the relationship between physicians and government, known as the Physician Master Agreement, or PMA. Through the PMA, the government allocates money for physician compensation and various joint collaborative committees and programs to improve the patient and provider experience. We also negotiate on behalf of individual or groups of physicians that are paid through alternative funding models. We develop policies outlining our position on a range of health topics, which are used to advocate for patients and physicians. We collaborate with government to improve the healthcare system and the health of British Columbians through the 4 joint collaborative committees established under the PMA. We work with government to incentivize high standards of care, promote quality improvement, and promote physician engagement at the regional and local level. And we provide a range of benefits and services to our members, including insurance, wireless phone plans, negotiated benefits, funding for continuing professional development, and billing and audit support. Doctors of BC has evolved from an organization that primarily focused on negotiating physician compensation to an organization that collaborates with others to improve patient care and the lives of physicians.